So the Pinnacle Plan starts out with point 1, and really point 1 focuses around the issue of ensuring that we have the right number and the right match of foster families for our children who unfortunately may have to be in foster care. And specifically focusing around increasing not just the number but the support, the training for foster parents, the resources available to foster parents. A primary part of this goal also ensures that we can achieve by the end of the first year no children under 6 in our shelters. We all want to see children who have to be in care when that unfortunate circumstance happens to be able to be with a family. By the end of year 2, we anticipate having no children under 12 in shelters. And that the real sort of crux of the plan, if you will, is really focusing on getting the right number and an increased number of foster parents for the children of Oklahoma.
Is it under 12 or is it under 13?
I think it's under 13. I think it's 12 and under would not be in the
12
shelter.
Under.
Right. 12 and under, not in the shelter.
Correct.
Okay. Pinnacle Point 2 then focuses on creating the clear delineation of roles and effective lines of communication with the agency. This is the part of the Pinnacle Plan that really focuses on the restructuring that you heard the speaker mention. This is the direct line of authority and putting all of the staff together, not just the policy staff and the field staff, but also doing a direct report to the Director of Children and Family Services, but then that next step, which is also critically important, directly to the Director of the agency. So that, if you will, in essence, you have a agency focused on child welfare within the agency, all together, all in the same line of authority, and clearly delineating roles.
But you also see a career position or a appointed by the governor position or the commission?
All the positions within the Department of Human Services will be hired by the Director of the Department of Human Services, other than the few positions that are hired directly by the commission.
Okay.
And specifically, oh yeah, absolutely. And specifically, the other part that I think is exciting, if you look at Pinnacle Point 2, is sort of the restructuring of the districts, if you will. Currently, in Oklahoma, we have 26 district attorney districts, and the child welfare program and this integrated staff will be structured the same way, so that you have a lead for each of child welfare in each of the 26 districts who can work very closely with the district attorneys. You'll see in a second when we get to some more Pinnacle points that this is not something DHS can do alone. We're really going to focus on increasing partnerships, and that's one example of how that can happen. Pinnacle Point 3 really focuses on the areas of supporting the workforce. One of the keys to being the best child welfare division in our United States is having the best workers in that division. And so Pinnacle Point 3 really focuses on the support of the workers, specifically figuring out what is the manageable caseload, and this plan sets targets based on an internal workload analysis of what the right number of children and families are for our workers to really be able to provide the support and the services that are needed for those children. This Pinnacle Point also calls for an external workload study that will allow us to look and really evaluate what is the work that these workers are doing. You can't simply say what's the right number of children until we also look at what is the work that these workers are doing. What is it they're doing on a daily basis to meet the needs of these children? So Pinnacle Point 3 focuses on that area. Pinnacle Point 4 is really focusing on something called the practice model. The practice model is really about two things. It's about how the Department of Human Services interacts with families. How do we interact with families from the first time that we meet them? What do we do to engage families, to support families, to whenever possible provide what a family needs so that a child can be in their own home and be safe? And when that can't happen, to ensure that we get to reunification as quickly as we can. And if unfortunately that can't happen, then get to adoption as soon as possible so that children really have permanency as quickly as it can be achieved in a safe environment. Pinnacle Point 5 focuses on the fact that we know that work must be of good quality, high quality, and transparent. This is really focusing on ensuring that we use data at all levels in the organization, from the worker up to the agency director and the commission, to say this is the data that is happening, if you will, for example, at a county level, at a specific worker level for children in the state of Oklahoma. To incorporate all the data, one of the things that the Department of Human Services and fortunately has a plethora of is data, but really pulling this together to make sure that that data gives a specific picture for the families that are being served and that that's available to the public. One of the things that Deb has actually envisioned is potentially a map of the state of Oklahoma, an interactive map where you could click on any county at any time and see the outcome data for the children in that county, and really making this a part of the everyday work. That what we would be doing with local workers, with supervisors, with teams, is looking at data, coming up with plans for where we need to see improvement, and holding folks accountable and providing the resources to make sure that that data improves. Pinnacle Point 6 focuses on the fact that we must ensure safety of children in out-of-home care, and that children need to have very regular visits with their caseworker. The good news is the Department of Human Services has a great track record already of visiting children when they can't be placed in their home, but this really focuses on the issue of making sure that we are ensuring safety for all children in out-of-home care. And so let me stop for just a minute and talk a little bit about one of the things I think it's going to be important, and you all are actually going to be able to be the conduits of to help make sure that the public understands this. Currently, the Department of Human Services reports data to the federal government about abuse and neglect in our state. And there are two divisions responsible for that right now, meaning that there is one division who does that for children who are in foster care, and there's another division who does that for children who might be in something like a group home or a residential treatment center. Currently, while all that data is collected, not all of it is reported in the same way to the federal government. One of the things that's really important in this plan is to ensure that all the data is reported accurately and together to give a complete picture. What that means, and you'll see a matrix in here that attempts to, actually, Nolan's right on that page, it's page 26, that really attempts to try to give this picture. And what I mean by that is, initially when all the data goes in, it's going to look like there's a very large spike in the number of children who experience abuse and neglect in Oklahoma. It's not that there's a spike, it's that that data had never been reported the way that it could have been before. And so what this chart attempts to do is give you several years back of what it would look like, but initially what citizens will see as a spike, but it's really to get complete data reporting so we get a complete picture.
Is there already an existing model of that shift in data collection?
When you say is there already an existing
model?
model?
Did you all develop it yourself, or is that?
For how we're going to report the data, do we already know how we're going to do that? Is there a data model?
Yes, there are federal requirements for how you would report.
So it'll be better aligned with the federal requirement.
Correct.
Thank you.
How will that change our comparison to other states?
Well, one of the things, and I'm going to attempt to answer this, and then Deb's going to tell me when I get this wrong, one of the things Oklahoma does really well is that we have a very low threshold for what we consider abuse and neglect. So our numbers actually already look higher than some states. There's about 14 states that report the same way we do. And when you compare those 14 states to all the states, those states look like they have higher rates of abuse and neglect, but we report more data with a lower threshold. So if we were compared against all of those, just those 14 states that report the same way, we're currently right in the middle of those 14 states. When this data is added in, I don't know what that will do for us. Do you have a feel for what that picture will look like?
There will be an increase. So where maybe we were in the middle of those 14 states, if those other 14 states stay the same as they are today and don't change their reporting system or process, we will more than likely move more towards the end of having more abuse, neglect, and care.
So out of 50 states, we were somewhere around 42, 43, now we're going 50.
Yeah.
I understand what y'all are saying.
Right. Right.
Pretty
Because
close. We'll be pretty close.
Right. One of the things I think that we can all be really proud of at the end of this, though, is that we will be reporting the true picture of every incident of abuse and neglect in care, and we will have probably one of the most comprehensive and transparent and fully accountable data reporting systems in the nation.
The other thing that I would add is that there are also initiatives in here to reduce the abuse, neglect, and care. So it's not just the reporting. We have things built in here to improve that as well.
When you look at the last point, Pinnacle Point 7, Pinnacle Point 7 is incredibly important. This is the part of the Pinnacle Plan that really focuses on community engagement and community partners, bringing in other state agencies, the private sector, the faith-based communities, tribes, everyone working together so that we are all doing what we need to do for Oklahoma's children. Because if any of us, and I don't think any of us are, but if any of us are under the impression that the Department of Human Services can do this alone, we're never going to achieve what we want to see for Oklahoma's children. This really talks about the need for all of us to be working together and gives some specific strategies about how we can accomplish that.